Today I am reading from the book Spirit of Homeopathy, book written by Dr.Rajan Shankaran, Mind section, chapter number 37, Selection of Remedy. A group of computer experts in Bombay asked me whether I could make an expert system. I was tempted to do so, especially as I wonder whether I could systemize my own method of selecting the remedy. This gave me a chance to think about what I do. Step by step, I shall attempt to put these thoughts into this chapter. Under level, image of the patient. The first thing I do when I see a patient is to observe everything about him. It is not only observation of detail, such as how he dresses, talks, and walks, but it is also the impression that he makes. As I go on with the case taking, I note his every gesture or act and every peculiarity of his nature as narrated in his history. Slowly, I build the picture of the person in mind, and in the formation of this image, I try to depend upon his uncomposited features. Initially, his general appearance, such as whether he is excited or calm, dependent or independent, hurry or slow, strike me later. I start noticing specific thing. We have to go from the general to the specific. That he is an anxious person is more important than what his anxiety is about. The rule I use is what the person is more important than what he has. If we proceed in this fashion, the mistakes are minimized. We ask, when do you get angry? I get angry after sleep. The patient's reply. Anger after sleep is the rubric we may select. Here, we may make a mistake since the anger might have some reason, such as his neighbor making a lot of noise in the morning and his helplessness about it. In his case, suppressed anger is the more appropriate rubric since it represents the basic nature of the person rather than the merely his one symptom. I once read a book about I once read a book about the best flower remedies, and though I never use them, what I found interesting is that the remedies are not prescribed on the symptom but on the whole state. You are compelled to define the state first and only then the symptoms. What state the person is in has the understood first and only then the symptom that he has. No doubt, I listen to his word, but more important is his use of the word, his tone and the manner of saying them, and the context in which they are said. Gradually, an impression of the person is formed in my mind. Then I go further. For example, in any anxious person, I try to find basically what his anxiety is about. This may happen spontaneously. I did not ask the questions as it is quite likely that answer will emerge. I keep them in a corner of my mind and proceed with the history. I see whether anything goes against this idea which I am forming in my mind. I am very skeptical about my own judgment. That is a key to success. The scientist or physician who is willing to prove himself wrong will be successful. The more certain you are, the harder you need to try to prove yourself wrong. I am not talking about the remedies at all. The more I keep remedies out of my mind, the more successful I will be. The secret in prescribing homeopathy remedy is to unprejudice, to experience every case as a new case, to go into the patient's case as if you have never seen a similar case before. Now on the label, from basic component to situation. What is useful in the examining the person's situation in life and how he views them? You will always find a difference between how they are and how he views them. I especially try to understand the condition that he has set up and try to go into the feeling from which these conditions arise and find out where in his life he faces restrictions or blocks. These feelings and compulsions give you the basic component of the person on which the totality of the symptom or the mental state can be erected easily. Each component has to be confirmed, and when you put together, this component will give the good picture of the patient's mental state. From this, I make a picture of the situation in which images himself to be and therefore require all this component. Here we are touching the deepest hidden feeling of the person. We have to be very cautious not to feed the person into something we already know. The patient himself is not very sure at this point, so even he may not be able to confirm or deny what you say. You could push the wrong idea of the patients if you ask leading questions. So this is an area where you have to be very careful. If you are not very sure, it is better to stick to the component. It can also be an area which is very rewarding if following carefully. Once I have done this, my understanding of this his state is complete, then I understand physical generals and peculiarities. Most of the time, I am also able to connect physical generals and peculiarity with the mental state. If, however, I find some physical general symptoms or local peculiarity is not covered by the remedy I am considering, then I review the whole symptomology and see if there is a remedy which covers the physical and peculiar symptoms as well as which has a similar mental state too. The idea is that mind and the body are often two expressions of the same basic disturbance and must be equally covered by the remedy. If this does not occur, then their preference is given to the remedy that covers the mental state. If there is a very strong physical characteristic, then we have strong reason to carefully consider a remedy which covers this. Put together, this aspect form my totality of the case. Now under label, fit the patient into the remedy. I then go to the repertoire unless I can see the remedy without an iota of the doubt. I have to compare several rubrics and make cross-reference in order to find the exact rubrics. I may interpret a rubric imaginatively, yet at the same time I have to be very careful not to fit a symptom into the particular rubric just because the remedy I have chosen is there. I take care to see that the important symptoms of the patient are in the remedy I select. Yet, the important features of the remedy should be found in the patients too. By important, I mean the symptoms which are nearest to the basic feeling of the remedy. Some of these symptoms may be found in a compensated or overcompensated form, which may deceive us unless we look at the uncompensated behavior such as found in a dreams. The less important symptoms of the patients need not to be found in the remedy. Similarly, the less important symptom of the remedy, like a particulars, may not be found in the patients. I have made a formula upon two aphorisms, namely 164 and 211. I call the formula 375. I just read the aphorism 164 and then 211. Aphorism 164. The small number of homeopathic symptoms present in the best selected medicine is not obstacle to the cure in case where these few medicinal symptoms are chiefly of uncommon kind and such as are peculiar distinctive of the disease. The cure take place under such circumstances without any particular disturbance. In aphorism 211, this hold good to such this holds good to such an extent that the state of the disposition of the patient often chiefly determines the selection of the homeopathic remedy as being a decidedly characteristic symptom which can list of all remain concealed from the accurately observing physician. From this I gather that Hahnemann had the same idea. Example, we need not try and fit all the symptom of the patient into the remedy, but the symptom of the mental state, which will be the reflect in the physical journals since they come from the same sources, means the symptoms of the mental state must fit the remedy that we select. The task of selecting the remedy of which I given broad and general guideline is in fact a very laborious but artistic process. With a great circumspections, observations and understanding, empathy and with the use of reference books such as Materia Medica and Repertory, you will make fewer and fewer mistakes. Referring to this process of selection of the remedy, Hahnemann in the footnote aphorism 148 says, this laborious search demand a study of the original source. Now, a case example. A medical doctor aged 28 came with a severe rheumatoid arthritis. She was born in Delhi. During pregnancy, her mother had no problem. When she was 5 or 6 years old, the family moved to Mumbai and she used to get attack of sneezing. During her second year of the medical college, and she started getting up trouble in one small joint. She had taken a treatment, developed a tuberculosis, and had been treated for this for 1 year before she met me. Some features that emerged were that she does not get angry easily but remain depressed. She is always thinking with a negative, pessimistic attitude. She remains tense due to illness, feels helpless and fear she will get crippled. When she is alone, she broods and feel left behind. She weeps when consoled and feels better by weeping. The only craving I could elicit were for sweet and spice. Now, observation. I found that her pace was quite slow and she had no hope. She came to me to see if I could give her some relief from the pain. She could not move when I told her that she could improve and get cured. She refused to believe me. She had been to a homeopath earlier and her condition had worsened. And she said that a medical practitioner she know earlier and sorry a medical practitioner she knew that he prognosis was very poor and the x-ray bony changes were seen with a well irreversible and there was no sense in my offering hope. I told her that there was a hope and offered to slow down show some case like her and which had improved a lot and could be confirmed by her with x-ray and she still refused to believe me. I sent her away without medicine before because I thought that unless she was positively motivated to take the treatment, then it was possible to treat her. It was useless. I suggested some books on holistic medicine and asked her to see me after a month. She came back after 2 months. She brought her sister along. This time, she begins interview by saying that she had taken a gold injection without relief and rheumatism had prescribed chloroquine means quinine preparation which steroid and with steroid and that the chloroquine had helped. She asked she said she was interested in taking up a job in a pharmaceutical company because she was interested in knowing about the recent advance in the medicine. She had a several thought. One of the thought was to make lot of money and then at the age of 35 to retire and buy a nice house in a village. Sometimes she had the thought that she should go and help Mother Teresa or some other social worker. When she had this thought, she felt quite optimistic about getting well. But the rheumatologist had said, "How can your shoulder get better when the bone is eroded?" When she asked for my opinion, I said it was possible. She asked how it could be possible, which we know that the bony changes are irreversible. How could the medicine bring back the bone? Since the day her rheumatoid arthritis was confirmed, she became pessimistic. She felt crippled and that her ultimate destiny was a wheelchair and become totally dependent on others. She felt what was the use of living but lacked the courage to commit suicide. Again, I tried to motivate her to give up the allopathic drugs gradually and to look for a total cure in any system. She refused to take the risk. Again, this time I sent her away with more book on holistic medicine. Through she was repeatedly requesting me to list give her medicine to alleviate the pain. On one occasion, she even called me senile because I refused to give her medicine. I was not giving medicine for two reasons. Firstly, I wanted to be sure of the remedy, and secondly, it was no use to prescribe if she was not motivated. She was not interested. From the sister, I got the impression that she was a mild person who was gullible and could be easily fooled. After the illness, she had become introverted, despairing, pessimistic, and resigned to her fate. And she was not strong emotionally. Resigned to one's fate was coming up again and again. I did not see anxiety in her, but only that she had firmly accepted her incurability. Just wanted some relief from the pain. And she was young, and here I was offering her not just hope, but strong hope. Not only was I showing her cured case from my practice to prove that what allopathy considered incurable can be cured, but I was also showing her books written by allopaths themselves that even a cancer can be cured even without a medicine. She was unwilling to listen. She was so completely fixed with her feeling of the hopelessness that she could not accept even slight reassurance from me. She was dull, so slow and pessimistic. The disease was troubling her, but she could do nothing about it. Even towards me, the reaction was the same. When I made her come 3 4 times without giving any medicine, she would request a remedy. From me each time, and when I refused, she would walk away, resigned as if it was a troubling her and she could do nothing about it. This was the impression I was getting. Somehow, by the fourth interview, I was able to motivate her, and she could see I was sincere in my effort and in my faith to make her well. Then she was able to accept that as my medicine started giving her relief, she could reduce the cortisone and other drugs. But to make her do this was for me is a Herculean task, very tough task. She was very difficult patient because she could not accept the hope. She should have a felt fortunate that in spite of her illness, she had found a person who assured her of a health. And I took a rubric. The delusion, unfortunate he is, indolence, timidity, and cowardice. She is slowly and lazy, and she will not take up any step before because she feels the situation is so bad that nothing can be done about it. It is very bad luck. I am getting crippled. The disease is troubling me, but I cannot fight the disease. There is only one moment when she optimistic in her thoughts, either making money, building a house, or helping society. Ideal things. At that this time, she feels good, but revert back immediately as if she has woken from a happy dream into the reality of misfortune. There is a need in her to build a big dream, fantasies. Her reality was opposite to her fantasy. Only a beggar needs to have the fantasy of being a king. But does she really feel she can fulfill the dream? No, only the thoughts gave her pleasure. So I took a rubric theorizing, plans making many, absorbed in the thoughts. Theorizing is in the evening after the day's work when the planning has no practical use. When you plan in the evening, you do not want to do anything about it. It is just fantasy. Her interest is to working in a pharmacy and discovering new medicine, which again is a theorizing. You see the confirmation of feeling that she is unfortunate, timid, cowardly, indolent, cannot do anything, and in her fantasy, she is just the opposite, lucky, fortunate, building house, active, and courageous. She has also the rubric suicide has a symptoms suicidal but lack courage, discouraged, and obstinate. What is the situation she imagined herself to be in? The situation is that she is being troubled and suppressed by the disease, and she cannot do anything about it. She cannot fight back. She is totally helpless. She needs to pessimistic without hope because hope is harmful. So the only things she can do is to sit and fantasize things nothing can be done to her help her. This is the reason she was unwilling to accept the hope and unwilling to accept good fortune. When we study this rubric, we get the China, which is confirmed by the craving for sweets and spice. An interesting thing was the relief she got from the chloroquine through administration empirically and in the crude form. It was as if she was taking a China in the mother teacher form. I immediately stopped the chloroquine and started her on the China 200. I have been treated her with the China given twice in the 7 month. She has done wonderfully well. We have brought her cortisol level down from 2 mg twice daily to nil. Now only her joint pain better, but the morbidity of the shoulder is coming back. Something she could not do have hope for even in her wildest dream. Now she has asked me to suggest some book on homeopathy because she is interested in studying it. Understanding the patient is just like a creating a portrait. In a portrait, we do not start with the nose or eyes, but with the outline. Then slowly we fit in all the detail. In the same way, we have to approach the person in a broad manner, make a general outline first, and then slowly all the details will be fall into place beautifully. I realize that to make a computer expert system to select the remedy does not sound right. It is we who have to become an expert instead of trying to make an expert of the computer.